Good day, ladies and gentlemen. Today we're gonna be discussing a correlated topic to the physical and motor development presented by the first group, accompanied by yours truly, Alcazar, Ablier, and Baldonado. But before we could push thoroughly with the discussion, let us just be reminded of the core objectives of this discussion. First is to know further on the developmental milestones of the children and adults. Second, to be able for us to determine different exceptional children development with regards to ADHD. Third, to reflect on those topics and put self-realization on utilizing the information as future educator. Fourth, to create an insightful environment during the presentation. And these objectives, we will achieve this by the end of the presentation. So, without further ado, let the presentation begin. Exceptional children development, physical and sensory disability or ADHD. One of the most common psychiatric disorders in children is attention deficit hyperactivity disorder or ADHD. Its course and outcomes are heterogeneous. Sensory processing problems impact the nature of response to daily events. ADHD and sensory problems may occur together and interact. Sensory processing problems in children with ADHD is not a well-studied area. Sensory processing problems in children with ADHD are common than typical developing children. Findings do not support that ADHD subtypes are distinct disorders with regard to sensory processing problems. However, comorbidity with oppositional defiant disorder and anxiety are predictors or more severe sensory processing problems in children with ADHD. The symptoms of attention deficit hyperactivity disorder or ADHD are relatively common in the community sample of children. The rates for boys and girls are 13.6% for boys and 6.5% for girls. This disorder is usually comorbid with other disorders. More than two-thirds of clinical samples of children with ADHD have at least one comorbid psychiatric disorder, which are more likely to be oppositional defiant and anxiety disorders. The high rate of psychiatric disorders is not just confined to the children, but their families also report high rate of psychiatric disorders. The rate of psychiatric disorder comorbidities does not differentiate between ADHD subtypes. Attention deficit hyperactivity disorder or ADHD is a brain disorder that affects how you pay attention, sit still, and control your behavior. It happens in children and teens and can continue to adulthood. Sensory processing disorders. Sensory processing disorders are impairments in responding to sensory stimuli such as impairments, detection, modulation, or interpretation of stimuli. Sensory processing problems impacts the responses of children to sensory events in daily life. 5.3 of the kindergarten children meet screening criteria for sensory processing disorders according to their parental reports. One type of sensory processing problem is sensory overresponsivity or sensory hypersensitivity. That is, individuals respond to sensory stimuli in a way that is faster, longer, or more intense than what is expected. This response can be towards any type of sensory stimuli. Sensory overresponsivity can be considered as an independent diagnosis. For example, a child with tactile sensitivity or defensiveness might be defensive or hair brushing or haircuts because she or he cannot tolerate it easily. Another form of sensory processing problems is under-responsivity. Individuals with under-responsivity are unaware or they are slow to respond to sensory input. The third type of sensory seeking, where individuals crave or display interest in sensory experiences. Sensory discrimination problems are another type of sensory processing problem characterized by difficulty interpreting the specific characteristics of sensory stimuli. There are multiple sensory modalities, but they are not separate and interact with each other. For example, sound alters vision or vision alters sound location. An example is that when we watch television or movies, we perceive that voices originate from the actors on the screen, while there are large spatial discrepancy between the origin of sounds and the actors. Children are more likely than adults to have SPD, but adults can have symptoms too. In adults, it's likely these symptoms have existed since childhood. However, adults have developed ways to deal SPD that let them hide the disorders from the others. There is some debate among doctors about whether SPD is a separate disorder. Some doctors don't argue it isn't. Some say it's a diagnosis for things that could be explained as common behavior for children. Others say some children are just highly sensitive. Some doctors say that SPD is a symptom of other disorders such as autism spectrum disorder, hyperactivity, attention deficit disorder, anxiety, and etc., and not a disorder itself. Other doctors believe that your child may suffer from SPD without having another disorder. Some say it's clear some say it's clear that some children have trouble handling regular sensory information or stimuli, but for now, SPD isn't recognized as an official medical diagnosis. Tactile sensory disorder. The word tactile refers to the sense of touch, and tactile dysfunction, also known as tactile sensitivity, is a form of sensory dysfunction that causes the sense of heightened or to the point of discomfort or even pain. Tactile defensiveness is not due to tactile perception impairment, but the impairment of central processing somatosensory information. Children with tactile dysfunction feel certain sensation more strongly than most people do. What might be a minor annoyance to one person can be extremely uncomfortable for a person with tactile sensitivity. Shoes that are laced bit too snugly might feel that is painfully in tight. Certain fabrics can feel scratchy. The textures of some foods can be also off-putting to your child that they can eat them all. If your child has tactile dysfunction, he may be very sensitive to heat and cold, or to the sensation of water or wind hitting his skin. Children with ADHD have more difficulties in tactile processing. The level of tactile defensiveness in females with ADHD is higher than of males with ADHD. Tactile defensiveness is not part of familial risk for ADHD because it is specific to children with ADHD and not to their sibling without ADHD. Sensory overresponsibility in ADHD is associated with anxiety. These children have higher level of anxiety than those ADHD children without sensory overresponsibility. The hypothalamic pituitary adrenal axis is influenced by tactile sensory overresponsivity in children with ADHD. The symptoms of oppositional defiant disorder are predictors in hypersensitivity scores of tactile sensory function in ADHD. The impairment is not related to ADHD subtypes or gender. Another study reported that tactile defensiveness in girls with ADHD is more than boys with ADHD, and the level of tactile defensiveness in boys was not different from the control of boys. Control and vestibular systems. There are very few reports about balance problems in ADHD. Balance performance and ability for equilibrium and postural control in children with ADHD combined type are more impaired in comparison to typically developing children. More than one third of the children with ADHD have poor balance and coordination. Children with combined type ADHD without learning disorder do not usually benefit from vestibular stimulation. More studies considering covariant factors are required to reach firm conclusion. Dizziness and vertigo are symptoms of vestibular balance disorder. Balance disorders strike at any age, but are common as you get older. Your ear is a complex system of bone and cartilage. Within it is a network of canals. These are called semicircular canals. The canals are filled with fluid. The position of fluid changes with movement. A sensor in the ear that then sends the information to your brain to contribute your sense of balance. These are other delicate pieces make up the vestibular system. Certain things can affect the signal from any of parts of vestibular system causing symptoms. This balance problem in ADHD is associated with the sensory input, the sensory integration, and or the inhibition of excessive movements. Auditory processing disorders. Auditory processing disorders, or APD, also known as central auditory processing disorder, isn't hearing loss or a learning disorder. It means your brain doesn't hear sounds in the usual way. It's not a problem with understanding meaning. People of all ages can have APD. It often starts in childhood, but some people develop it later. Between 2% and 7% of kids have it, and boys are more likely to have it than girls. The disorder can lead to learning delays, so kids who have it may need a little extra help in school. Children with tactile dysfunction feel certain sensation more strongly than most people do. What might be a minor annoyance to one person can be extremely uncomfortable for a person with tactile sensitivity. Shoes that are laced bit too snugly might feel that is painfully in tight. Certain fabrics can feel scratchy. The textures of some foods can be also off-putting to your child that they can eat them all. If your child has tactile dysfunction, he may be very sensitive to heat and cold, or to the sensation of water or wind hitting his skin. Children with ADHD have more difficulties in tactile processing. The level of tactile defensiveness in females with ADHD is higher than of males with ADHD. Tactile defensiveness is not part of familial risk for ADHD because it is specific to children with ADHD and not to their sibling without ADHD. Sensory overresponsibility in ADHD is associated with anxiety. These children have higher level of anxiety than those ADHD children without sensory overresponsibility. The hypothalamic pituitary adrenal axis is influenced by tactile sensory overresponsivity in children with ADHD. The symptoms of oppositional defiant disorder are predictors in hypersensitivity scores of tactile sensory function in ADHD. The impairment is not related to ADHD subtypes or gender. Another study reported that tactile defensiveness in girls with ADHD is more than boys with ADHD, and the level of tactile defensiveness in boys was not different from the control of boys. Visual and olfactory dysfunction. Odors are powerful stimuli that not only evoke a sense of smell but also influence our mental states. In the real world, since we empirically know that the effects of odor, we use them in our daily lives. In scientific research fields, a number of studies on human cross-modal effects have shown that olfactory information interacts with other modalities in such high-level cognitive functions as emotions. In fact, it is often considered natural that olfactory stimulation influences such as high-level cognitive functions, because the brain regions of olfactions and other cognitive functions are anatomically located near overlap and functionally associated. Hanma et al. Showed that olfactory function was unaffected by visual information in patients with PD, supporting The hypothesis that PD impairs cross modality between vision and olfaction, healthy participants tend to overestimate the order when presented with an original picture. For example, a picture of caramel pudding without a methyl cyclopentolone odorant will be perceived as pleasant. In contrast, patients with PD tend to concentrate more on the smell rather than influence of the visual stimuli. The, the odor estimate independent of vision of patients with PD. Olfactory perception is ambiguous, and the smell may be hard to identify without verbal and visual assistance. It is true that olfaction is modulated by visual elements. This multimodal integration of responsible for the OFC, which receives information from visual association and the olfactory, gustatory, somatosensory, and other auditory areas. Recent brain imaging studies showed that OFC participate in vision olfactory and integration in healthy individuals. Gutterfield and Dolan noted higher activation of OFC when a smell is presented with word label. Cognitive factors such as visual stimuli modulate representation of odor at a relatively early level of cortical processing, known as top-down cognitive influence, which directly affects emotion. Healthy participants exhibited dominance of the visual sense in the study. On the other hand, patients with PD exhibited decrease of dominance of visual information. They concentrated more on olfactory perception without modulation from visual input. The OFC in patient with PD is known as to be less active for all modalities during stimulation, including olfaction. Decrease in activation of the OFC in patient with PD may partly account for declining closed modality. Moreover, detection and cognition levels for odor were lower than those in the controls. During olfaction, the OFC also integrates information from AMG and HI, which play a role in emotional information and memory retrieval. Reduction of OFC function may lead to deficits in recognition and identification of odor. Thus, patients with PD may tend to focus more on smell detection, which may lead to activation of the basic primary olfactory areas such as ENC and PIR. That is the end of my discussion. I hope you guys have learned something on the topics that I discussed earlier. And to the future educators there, these are the things that we need to remember and to consider in assessing our future students in school. Have a great day and please stay safe.